echo. Okay. So welcome to this meeting of the Children's Services Overview and Scrutiny Committee. We'll firstly take any apologies.
Apologies from Rebecca Maggett. She's being substituted from by Sam Akhtar.
Okay, thank you. I believe that Prue is going to join us online. Yet, but I guess she's going to join. Okay, so the next item is the minutes of the previous meeting. Any comments or suggestions, any objections to the minutes? Andrew?
I have a number of questions about the minutes, if that's okay.
Yes, okay, yep. Carry on.
Okay. On page 8, there's a reference to the A-levels and GCSEs. I'm just wondering if we could get some information about how they will be assessed this academic year. Secondly, was from page 9, was data on the September catch-up program circulated? And are there any plans for further catch-up sessions? And finally, if this doesn't arise later in tonight's meeting, is it possible to have an update on the postponement of the opening of the new SEND school and also a brief evaluation of the implications of this? We might also want to consider adding this to the agenda for the next overview and scrutiny meeting. I don't know. Thank you.
Okay, I think the third one, the SEND school, Prue already asked a question, and I think we can pick that up on the Children's Services strategy. So we will cover it there. If we don't, then please remind us at that point. So I wonder if Carol, you'd like to take the other two questions, please.
Yeah, I can't answer them though, Chair. I'm sorry. So I'll have to take them away because I'm not sure. We've got Heather on the line. Heather, I'm not sure if you can answer those questions about how children are going to be assessed this year, and the other question that Andrew asked about data.
Hello, I'm here. We're still not clear about assessment this year. There is talk about reinstating testing, but I think that all depends on how things go with COVID. Teacher assessment remains as important as ever, but we haven't had any validated data since 2019, so we are in pretty desperate need of having testing reinstated, and I think that is the intention of the government at this stage. What was the other question, Carol?
Andrew, could you repeat the other question, please?
Yes, certainly. There was a reference in the last meeting to the September catch-up program, the summer catch-up program. This is for children who'd fallen behind for COVID-related reasons. Are there any plans? Did we receive any data on that program? And are there any plans for further catch-up sessions?
I am new to role. I've only been here a couple of weeks. I have not seen any data on that. I will take that away and find out.
Thanks, Heather.
Okay, thank you very much. Any other questions or comments on the minutes of the previous meeting? If not, are you content that I sign those?
Apologies for being slightly late.
Okay, thank you. It's good that you've joined us. Thanks, Prue. Can I sign these minutes as a true record of the meeting? Everyone content? Seems that everyone's content. Thank you. Okay, next item 23 is declarations of interest. Are there any declarations from any of the members present? There are none. To move on to 24, public question time. There are no public questions. 25 member question time, no member questions. So we'll move on to item 26, which is the children missing in education. We have a paper in front of us, page 19, sorry, page 13. Cal and your team, who's going to introduce this paper, please?
That'll be Heather, thank you.
Okay, thank you.
You're on mute, Heather.
Sorry.
All right.
I think this paper speaks for itself. It introduces itself by saying that it is written to respond to questions that were raised at the previous meeting. I couldn't actually see what those specific questions were in the minutes, but I assume the report's been written to meet those requirements. In summary, we have a positive picture on CME, a reduction in number of CME below national average, positive trend, rates of permanent exclusion below national. It's all very good, but underlying that, we do have a disproportionate representation of children with SEND subject to exclusion. So when we come on to the conversation around the overall children's strategy, that is one of the issues that's a golden thread throughout that strategy, where there's action to strengthen early intervention and to develop the culture of inclusion, where all school leaders share accountability for those children and the outcomes of those children. I think because this was written in response to specific questions, I'd like to take feedback on whether whatever information was being sought, does this report actually provide that information adequately, and if not, what other information would you require?
Okay, thank you very much. Questions from members? Andrew?
Yes, thank you, Heather, and to everybody who was involved in producing this report. I do have a number of questions, and I'd like to start off, if I may, by looking at or by probing a little your views on what success would look like in terms of CME. You mentioned, for example, that you'd like to see all school leaders sharing in accountability with regards to inclusion, which I would regard as a success criteria. I'll ask a second question as well at this point, if I may, and that is, could you just clarify exactly what children's services, including the educational welfare services, role is in relation to CME, including what powers and other levers it has to get these children back into education, to stay in education, but to get them back into education as well. So they're the first two questions, if I may.
In response to that, I would say all services have a responsibility to ensure that children are not missing education, because it's our overall statutory responsibility. In terms of knowing who those children are, we do have a specific service who has that responsibility. But the reason children are missing education often is quite complex, and there are several reasons why that happens. School places, for example, and the availability of places that meet the needs of students, especially where they have exceptional needs, is, as you know, a big challenge in Wokingham. And it isn't easy to solve some of those issues. So again, if when we come to the conversation about the overall children's services strategy, there are so many accountabilities that actually enable an authority to ensure that children do not become missing education. So I would say it's a very broad accountability across all services, but with specifically we have the EWS and the service that's produced this report. I mean, there are admissions as well that kind of have to know where those children are, and the virtual school plays a role too, because some of those children might be lack. It is quite a complex picture. I could give you a better summary if given time to make that more clear for you. Does it answer your question?
Yes, thank you. And sorry for springing that on you, because I know this is a very complex issue. I noted, for example, your reference to a success criteria being the availability, of places that will meet the needs, of all children, often with quite complex needs and so forth. And that's the kind of, thing that I was interested in. So thank you very much. And also knowing who these children are. Okay, so thank you very much for that.
Okay.
Could I ask two other questions, Chair, if that's okay? Yep. I noticed that the definition or one of the criteria that's being used refers to children who've missed over 20 consecutive days of education. And this is a really two-part question. Are there requirements for schools to robustly follow up on children who are missing school for much shorter periods of time? In other words, are we really confident, that if a child is missing 2 days here, 3 days there, and so forth, that this is actually being followed up robustly, in the schools? And then linked to that, is it possible that some children might be falling under the radar of children's services by having frequent lengthy periods of absence that fall short of the 20 days? Yeah. So that's a two-part question. And then I'd like to go back to the matter of inclusion that you mentioned, both in the report and orally. And I think this is really important and really interesting. And I just like, if possible, if you might be able to give some illustrative, just one or two illustrative examples of the kinds of inclusion work that's available to support schools, governors and parents to try to reduce permanent exclusions. Okay. I noticed, for example, the reference to the rollout of the therapeutic thinking approach, which I think is really, really interesting. What other kinds of supports, are in place? And is such support something that academies, as opposed to schools in our local under local authority control, have to request, or is it something that will be offered, to all of the academies and has a high, hopefully universal take-up rate?
I can only partially answer these questions because I'm new to Wokingham and I don't actually know the detail of the answer. So Carol may wish to add to my response. Schools should be doing everything in their power to follow up absences below 20 days and patterns of poor absence. Yes, that is their responsibility, and supporting schools to do that is the role of the EWS. It is possible that children do fall under the radar if schools are not doing that robustly. So it's important that usually it's through the school improvement service, we monitor those figures in all our schools so that we can see trends in attendance that might actually also be correlating to exclusions. What other support other than the therapeutic thinking? It tends to be around early intervention, which needs to be in line with a framework that the local authority has about how do you identify children who have early needs and early additional. How do you identify those children with additional needs early, and therefore put interventions in place so that they don't start dropping out of the system and missing days here, there and everywhere, but not up to the 20 days. I think developing that graduated response is something that Wokingham has identified as something that needs to be strengthened, and that also is at the heart of the Children's Services Strategy.
Thank you, Heather. Just to add to that, Andrew, so the therapeutic thinking is being rolled out to all schools. It doesn't matter whether academies or they're maintained. And the local authority has front-loaded that in terms of costings, and it's a train-the-trainer model. So over a period of time, schools will then pick that up, and it will be embedded in as part of their model. But we have, if you like, supported that out of the blocks. The other sort of support that we've put in place to enrich the support to schools is that we've supported by funding a member of staff to undertake and mentor schools in undertaking all Year 9 annual reviews for children that have got educational, health and social care plans, so that all of those children's transitions plans are and independent plans are really robust at Year 9 to carry them all the way through. Year 11's a bit too late to do that. Year 9 is the optimum point to do that. So that's a 1-year programme to mentor, and then a further year's programme to review all of those children's annual reviews when they're in Year 10. And we'll be tracking those. There's about 55 children in that cohort, and we'll be tracking those 55 children through to adulthood. The graduated response that Heather mentioned, that work will be complete by March. And so that's working with schools to support them in understanding what their requirements are in terms of children with additional needs, and identifying where the local authority can support them further where required. But it is about our schools carrying out their duties and the local authority supporting schools to do that. So that's a little synopsis of where we're at. There's a huge amount of work going on in this area.
Okay, thank you very much. Any further questions? We've got Pauline first.
Thank you. It's a small question about a small figure. Page 14 says that last year there were 306 CME, and page 15 says that 307 were re-engaged with education. Where did you find the other one?
I think, isn't there an asterisk underneath that table that says one child was brought forward from the year before? Because I noticed that as well. I thought that was very odd. But there is an asterisk that says one child was brought forward. I don't know if you know the answer to that, Carol.
No, I only know that there's an asterisk that says one child noted as missing education in 2020 to 2021 is carried forward from 2019 to 20.
And was therefore integrated. So I don't know the details.
We can confirm that, Pauline, but I think that's what it is. Obviously, Heather's very new, and of course, the author of the report here with us.
That's what I thought, but it's good to have it confirmed. Thank you.
No problem.
Okay, Anne.
Good evening. Actually, just to follow on from that question, I noted that in the previous years, 2018 to 19 and 2019 to 20, I think the majority of children are re-engaged with education. If you look at page 14 and page 15.
Yeah.
I'm looking at the right, sorry. Yes, the majority of children were re-engaged with education in those years, but in 2020 to 21, apart from this mysterious child, you've got 100% have been re-engaged. Is that correct?
I can't comment because I haven't been in the authority long enough to know the detail of the data, but I expect it is correct if that's in the report.
Yes, it will be correct, Anne, and it's because a lot of children were missing education because of COVID. So children that were reluctant to go into school, anxious parents, etc. Once the COVID pandemic sort of settled, then obviously we did a huge amount of work to re-engage those children. So there's a big difference between 18, 19, and then the 2 years where we've been in the pandemic.
Oh, right, thanks.
A bigger.
Oh, that's excellent. I've got a couple more, I think, more questions. Sorry, just got to find them. Yes, does the council know accurately the total number of children living in the borough?
Yes, we do, but I can't tell you off the top of my head.
That's okay, but you know the number, because that's an interesting statistic to.
We know the 0 to 18 and the 0 to 25 number, because we have responsibilities to children to young people to 25 in certain areas of our service. So we have a 0 to 18 population figure and a 0 to 24 population figure.
Right, well, that's good, because then you can tell if any children are sort of missing in the system, can't you? So that's very good. One more question if I can find it. It's just that on page 16, I think it refers. Oh, damn it. Sorry. It refers to fixed term and fixed period. I think it's where that graph is. Yeah, the graph. It refers to number of fixed term exclusions and one or more fixed period exclusions. Is there a difference?
No.
No, fixed.
That's the same thing.
Yeah, it's just fixed term or fixed period or permanent.
Right.
So
okay. Thanks very much.
Is a period of days usually, and right. Permanent's permanent.
Okay. Thanks very much. That's it. Thank you.
Thanks, Sam. I think you had a question.
Thank you. Yes, my question was in relation to CME children 2019-20 and 2020-21, specifically in relation to page 15, paragraph 1, where it says children not attending the provision provided by school or accessing/engaging with any alternative provision provided, i.e. physical or remote learning, and pupils unable to return from abroad. Are there any, it'd be great to see if there are any stats available where we could see if any of the 306 CME children in 2020-21 or 212 in 1920, any of those were maybe unable to access the learning because they just didn't have access to a laptop, or maybe their parents didn't own a PC or a laptop or a tablet, just to include figures from if there was a subset of that element where they weren't provided with the equipment needed, so therefore they could not physically attend.
So we went to great lengths to ensure that all children were given equipment, either through the local authority or the schools. So I don't think we have that data, because I'm quite sure that all of our children were provided either with hardware, so a laptop, or dongles, so that they could get access to, they could have 4G access if they're in an area where internet wasn't very strong, or etc. And if they didn't, if they had no access to equipment, the local authority provided it. We had 3 ways of doing it. One was that we got money from the government, and so we rolled out a big program on that basis, because that worked out all of the children they'd identified as vulnerable, and that were in certain categories. They all automatically got equipment, and we got a big consignment of equipment delivered to the council office, and then our staff deployed them. We also did a call to arms from our community, which was that if there were any second-hand laptops that people wanted to hand in, we reconditioned them, and they all went out to children and vulnerable families. And then the schools also identified families that perhaps didn't fall into any of those categories that were identified, and they provided equipment. Where children preferred to do things with a kind of pack of, on a paper-based basis, because some children like to do that, schools delivered that as well. There was a really graduated and blended approach to how we provided support for children. So I don't think we would be able to find that data, because I think we were quite certain that we've covered it all off.
Brilliant. Thanks, Carol.
Okay, Prue, I think you've got your hand up. You've got a
Yes,
question.
I have. Thank you, Chair. And welcome to Heather. And I'm looking forward to working with you. I'm kind of dropped in the deep end this evening.
Yeah, she has rather. I was expecting one of her colleagues.
Yes,
I'm surprised and happy to see Heather, but I wasn't expecting you, Heather.
I got a couple of questions. I don't need the information now, but if it's easy to do, it would be really helpful to have a split between boys and girls on the children and who are not in education, and also between primary and secondary, but not if it's a lot of work. But I just think I'd like to get a sort of feel for it better, if we could have that information. But the other thing I wanted to know was, obviously we've got relatively small underlying numbers, as it were, of children that are missing education. I'm just wondering if you think there's any common reasons why that happens. Is it school phobia? Is it parents not engaging, or is it just a general thing and they're all different and you can't say anything about why it is?
You're on mute, Heather.
Well, I can't because I haven't got the information, but I would imagine they're all different.
Yeah. Okay.
We have the data because the numbers are small. There
Yes.
isn't, a bit like in children's social care, when we're looking for trends, it's very hard when we're small, because a lot, children have individual circumstances and we can't really draw any conclusions because our numbers are so small as to what the trend is. Obviously, we do have some children who are school refusers. We've got some of our children with additional needs who have, their integration back into school post-COVID has been a challenge, and we've worked with those families and with those children. We have a Gypsy Romani community, and some of those children are sporadically in and out of school, but there isn't any kind of Wokingham trend, if you like, that's easy to identify.
Okay, no, thank you. And the other question I had is actually about the permanent exclusions, which on page 16, which talks about children with special educational needs, but also the difference between the EHCP and the children with a need which hasn't reached the EHCP threshold, essentially. And I wondered whether, and again, this is something which you probably don't know tonight, but I would, if we can get the information after this, is whether there are any particular schools, or whether it's secondary or primary, that is disproportionately excluding. And I imagine if there's a particular school that you would be on it, so it's probably not as easy as that. But whether it's primary and secondary, because I think we have in the past thought that perhaps primaries were not the best equipped to be able to identify needs and deal with them because they're small and they don't have the specialists, and whether there's any of that happening that looks like something that we could do something about.
We will certainly have that information, Prue, and but neither Heather and I will have that at our fingertips right now.
No, I wouldn't imagine you would, but it would be good to know, to try and dig away at that, because clearly all the guidance is against excluding people with SEND needs. And for Heather's benefit, I chair the permanent exclusion panel at the school in Wokingham, and I'm also qualified to sit on independent review panels. So it's an interest of mine. Thank you.
Yeah, I fully endorse what you are saying.
Thank you. Thank you, Chair.
Okay, Andrew, I think you have another one.
Yes, thank you, Chair. I'd just like to add a follow-up question, if I may, to the area of permanent exclusions. Now, I know that the numbers are quite small, making statistical analysis challenging. But I also note that the data that you have provided on permanent exclusions includes children with EHCPs and SENDs. It does, who you report are disproportionately represented. It does not include any data by ethnicity, family socioeconomic background, and similar matters. Are there any groups besides children with EHCP and SEND who may be overrepresented? And if so, is data on these groups routinely collated and used to support these groups?
Data is normally collated according to those groups. I would expect that in any authority. I haven't got the data to answer the question specifically. I notice in the report it does refer to racial inequality as something that strategies are addressing. So I also wondered myself what that might be. So we could get that data for you. Carol, what's your thought on that?
Yes, so we do collect the data. We have it all broken down, and we do work with all of the different groups of children, if you like, that are excluded, to look at whether there are any trends in relation to particular groups of children having a prevalence to be excluded over another group of children, for example. We work with the schools in relation to that. So we will be able to get that, Andrew. We just, again, Heather and I are kind of both coming at this off the cuff in terms of being able to produce the numbers for you this evening, but we will have those numbers.
Thank you.
Any further questions from anyone? Not, then I think we're closed on that report. Thank you very much, Heather.
Thank you.
Thanks, Heather.
So we'll move on to item 27, which is the Children's Services Strategy at page 19. Who's going to introduce this paper?
So Matthew can introduce. So Matthew Booth, he's with us this evening on camera now. So Matthew, if you want to introduce the report, but the report is as it is, and really Matthew and I will kind of double play in terms of questions as you would like to ask them. Unless you'd like us to take you through, I'll give you a summary.
I think maybe just a very brief introduction would be helpful. But as you say, the paper's there. There's no point in going through it all, I don't think. Thanks.
So this is a piece of work that we've been undertaking for some time. It's a culmination of 2 years' work, really, to get us to the point where we've got a very detailed 3-year strategy. We did have a strategy prior to this, as members will recall, from 2019 to 2021. That was a kind of opening gambit for children's services from when I took over in role. We've worked very hard to make sure that this strategy is a whole children's services strategy and pulls together all the strands of all the different pieces of work that we have in our ambitions, and we have a program of delivery against the strategy. It isn't just a strategy that sits on the shelf. It's a very active document that we use as a live document to deliver against our priorities. All the service plans are aligned to the strategy as well. So which we've converted it into Word for you to make it a bit easier than having it in the working model that we have. So we have it in a different model so we can interact with it, but we've put it into a more readable format for you. And in there you'll see the governance structures and all those sorts of things. And Matthew is our independent chair for the Getting to Good board, which is why Matthew's here to answer any questions as well.
Yeah.
Okay. Anything you want to say at this stage, Martin?
I was just going to say to that, I mean, obviously it covers a huge range of activity across every aspect of children's services. So actually there's a lot of content in that action plan, which you will see in the appendix. But what we're really trying to do with this is we accept the fact that we've got to strike this balance between ensuring that the universal services for children and young people are of excellent quality and that Wokingham continues on this trend of providing excellent outcomes for the majority of children and young people. But it also acknowledges the fact that for a lot of children and young people in Wokingham, they're able to access a lot of those very high quality services relatively easily. that there are excellent outcomes for the vast majority of children and young people because they can access the support that they need as and when they need it with relative levels of ease. But there are this, as we've already been talking about in the children missing with education discussion, so there's this relatively small number, but still important number of children and young people who do need extra help. And those universal services are not sufficient to meet their needs. They need something else. They need something targeted. They need something tailored to their needs. And that requires us to be very precise in our approach and using data and information like we've been talking about this evening to make sure that the models of service delivery we develop are effective for those children and young people. So a phrase you see a lot in that report is all children and young people in Wokingham deserve these outcomes. And we know that for some, it's going to be a lot easier than others for them to actually be delivered. So a lot of the thrust of this strategy is about what we do to help those most vulnerable and the relatively speaking more disadvantaged. So that's what I would say. The report itself sets out, I think fairly early on in the report, 16 different types of child or young person, including children missing from education, incidentally, who form kind of priority groups for our thinking and our focus. So these people, we're actually saying these children and children who are subject to one or several of these factors are actually really important for us to bear in mind when we develop and deliver this strategy. And it also sets out a few of our key principles, for example, around early intervention, prevention and early help. That's a theme occurs across the strategy and the action plan. Strengthening inclusion absolutely occurs, not just in terms of children and young people with SEND, but actually tackling school exclusions and exclusions from leisure activities and universal services in general. There's a fair bit in there about managing demand, because we've got to manage the resources we have effectively to make sure we don't run out of money and we live within our means while we do all of this. And a lot about raising standards and focusing on outcomes. So as Carol said, there's a governance structure around this, which has also been included as an appendix to the report that sets out how we keep this under very close monitoring and review. We're setting very ambitious targets for where we want to go next in terms of the improvement journey for children's services, because it's been on a very significant improvement journey for the last couple of years. This is about taking this up yet another level again, so that we're punching way above the minimum requirements and way above just what regulators would like us to do, but do actually what's in the interests of the children and young people in the borough. Now, we could go on and on and on and on about the levels of detail within this report, but I feel, Chair, and it's entirely down to you and members of the committee about whether you prefer to protect the time for questions about the piece of work or any particular aspect of the content of the strategy itself. I think Carol and I would probably both be very helpful to go either way. Frankly, we could carry on in more detail if we wanted, or just move into questions.
Okay, I think probably move into questions, make it a bit more interactive, probably. Probably split it into three parts because it logically does so. The report itself up to page 27. So if we look at that first, and then we'll come to the action plan and the governance arrangements, probably pick them up separately, just so otherwise we'll be jumping about rather. So if everyone's happy with that, then any questions or comments on the main body of the report, please. Andrew?
Yes, thank you. I noticed in the recommendation that the committee's asked to provide feedback to the officers. So just a couple of sort of introductory thoughts. I felt that the statement of commitment to include the voices of children and young people is not sufficiently elaborated in the document. And I felt that there were probably missed opportunities, for doing this, opportunities to cite some of the methods that are already being used, deployed, to support this. So if possible, a little bit more in the next iteration on the voices, of children and how to ensure that they're heard. A point that Matthew has already made is the commitment to improve outcomes for all children, and I'm really pleased, all children and young people in our borough, and I'm really pleased to see this. It's a very laudable goal, but do officers really feel that that any strategy really, an action plan is able to achieve this for all children. Now, I'm not being cynical. I think there's a real issue here. For instance, in the area of education, do we feel, that sufficient attention is being given to help support the potential of the gifted and the talented pupils with all the different, types of talents that they might have in arts and elsewhere and so forth? Very easy, sometimes to overlook that. But if we're going to be supporting and improving outcomes for all children, they have to be included. What provision is in place? Another example, what provision is in place, perhaps as a part of early intervention, I don't know, to help parents who are struggling with child rearing skills? So two comments there about sort of areas that might, beefed up's not the right phrase, but I hope you see what I'm getting at.
Yeah. Carol, I don't know if you want to go first or if I want to go first, but
I don't mind, Matthew. So we're talking about the covering report at this stage, Andrew, and I think that the all of the different service plans that we have and all of the different strategies we have across that sit underneath the overarching children's services strategy address those issues that you have raised. We have an early intervention and prevention strategy. We have early help services that obviously work with families. We have our Compass team that also works with families, and we do parenting and parenting support. We obviously work with our health visiting service, who are based co-located with our children's centres. So there's lots of support for parents to access from a very young age. In terms of the very, very bright and talented children, we are very fortunate in Wokingham that most of our children do very well, and they are supported by their parents by and large, those children that do not meet thresholds for specialist services, to achieve their aspirations, potential, ambitions, etc. We obviously have responsibility to support our corporate, our looked after children, our care leavers as corporate parents, and where we identify children that have extraordinary talents, we will do everything we can to support those children. We've got some, very good sports people, for example, in our looked after children's cohort. We've had a couple of children that have been very, very good footballers, and we've supported them in terms of being picked up and scouted by some major football teams, for example. And the exciting part of the next stage of children's services development is obviously the Unicef Program. And so that is where children themselves will be able to influence the future direction of children's services. And so it will be driven very much by children's voices and children's aspirations, in conjunction with the Youth Council and all of our other forums for children that are not represented as fully on the Youth Council. So, for example, our Children in Care Council, our forums for children with additional needs, etc., etc. So although we've come a long way and we are probably 2/3 through our improvement journey, there's the sort of sophisticated next nuanced stage of the development, which is those sorts of things that you are alluding to, Andrew, in terms of, being more and more and more and more kind of able to work through all of the different aspects that you're discussing. But we, that we are very fortunate because, as I say, most of our children do very, very well. So we are actually improving outcomes for the children that need additional support more than our universal children, because we are very fortunate that our parents are able to offer very good support to their children. And by and large, that's the vast majority of children. Nationally it is, but Wokingham it obviously is as well.
Just to add briefly on that, Carol, absolutely taking the point there that's been raised about the voice of children and young people in the next iteration. I think we've committed in the report to engaging with the Youth Council and the Children in Care Council and other groups to ensure that they are included before the ink is dry on the final iteration. So that's absolutely the case. There's also references in the action plan to where at the service level, they're capturing the voice of the child, the young person, the family through audits, through, for example, customer feedback, all of that sort of thing. And they will be incorporating that into how they improve their services going forward. The point that was raised around helping parents with child rearing skills, I would say, I think on that one of the lines in the action plan is around looking at things like our models of children-centred delivery going forward, and looking at what our optimum model of service delivery through children's centres, for example, should be. What does that look like in the future? We were speaking today with primary head teachers as well as secondary head teachers who are talking about the kind of services over and above education they find themselves providing to parents to help them raise their children in a much broader sense than you would expect from just education providers. They're providing kind of community service to parents much more broadly. So we were talking to them about, so what does that mean for us with the children's centres, with other community services, with other voluntary and community sector support, to actually really support our families to raise children and young people in the best possible way. So it's definitely a really valid point to raise, I would say, and very on point to the conversations we're having with key stakeholders right now.
I'm very reassured by those answers. Thank you.
Great.
Okay, Sam, thank you. You had your hand up.
Thank you. So my question, it's not really, it's just more an understanding. I mean, I think really great to hear on page 21, really the early intervention and prevention, early help. Completely agree that for young people, this is when you get them. If you get them early enough, you can kind of keep them on the right track. Really great to hear a little bit more about that and the sort of things you're doing to help people, and what, just a bit more about early intervention and sort of things you do.
Adam, do you want to field that one?
Me? Hello?
Hello. Adam.
So I'm having team trouble. So the question was in relation to early intervention prevention.
Yes.
So we have a range of services in the community. We have our early help team, early help hub, where families are referred to for support in relation to areas of parenting and support. And we do both universal and targeted provision from the children's centres that Matthew was referring to earlier, and that's the 6 children's centres across the community. So there has been, those services were impacted over the last year in terms of how that activity was delivered, and we've moved back now more to a face-to-face service delivery, but is more about pre-booking to sort of manage numbers at those centres. But we're not back to where we fully were with numbers before COVID, but we have, those services have been sustained throughout, and that can be a whole range of support services, parenting groups, and specific classes or work with families and parents and children.
Thank you.
Just to add to what Adam was saying there, and only because it's another very live topic at the moment, is around things like serious youth violence, exploitation, and other subjects of that kind, basically harm outside the home environment. There's a growing consensus amongst practitioners, one of which Adam is obviously a very key part of that group, that really, given Wokingham's demographic and the profile of that particular issue, an early intervention prevention approach is going to be front and centre of the strategy in that particular area. So it's a theme that is bringing partners together with us around very complicated topics like preventing youth violence, preventing harm outside the home. So early intervention prevention is becoming increasingly central to what's right to protect the most vulnerable in Wokingham, because there aren't hugely high prevalences of certain issues like youth violence and so on in Wokingham. So the best strategy appears to be to prevent any from happening in the future. So that is becoming an increasingly dominant theme in strategies that fall out of the overarching children's strategy as well.
And we also have prevention services for children with disabilities. We have a respite children's home, which is a prevention service because it offers respite to families with children with quite complex disabilities, and that obviously prevents those children from becoming looked after, and it supports families to be able to effectively parent their children. We also have our assist service, which works with children with additional needs, so children with ASD, does early bird parenting with parents that are that have very young children. We have our portage service, which works with very disabled children's parents to prepare them for their education pathway. So there's a huge amount of work that we do in that early intervention space to support our families to be as self-sufficient and as resilient as they can be, because we want our children to be living at home and supporting parents to parent their children, which is what the children, want and what their parents want. So we have a lot of focus on supporting children and families in those very early stages, either early years stages or early intervention at the earliest point of hitting our services.
And I was just going to add, Carol, of course, that we do preventative work at all levels across the service as well, because we have the Compass team, which works once children are already within the specialist services provision, and the focus of their work is preventing children coming into care, so working with those children on the edge of care.
Okay, so I hope that's helpful. That gives you a little bit of a flavour of
thank you so much.
What we do.
Pauline, please.
Thank you. 3 or 4 years ago, we developed a strong relationship with the fire service. I'm looking at the 5th point in our values, which, by the way, are very really positive. Point 5 says we drive partnership, collaboration and co-production. The purpose of the relationship that we developed with the Fire and Rescue Service was that we should tell them where all our vulnerable children live, so that when they go to a fire, they know what they're going to face and they know how to deal with it. The same should happen with older people as well. For example, a disabled child or somebody on the spectrum would need different treatment from a child who had no problems of that sort. I've got 4 questions relating to that. Firstly, is that relationship with the Fire and Rescue Service still strong? Secondly, do the fire service themselves keep you up to date with the person that you need to contact to give that information? And thirdly, do we have a designated person in the department to pass that information on? And fourthly, do we know whether the fire service does safe and well visits to homes with vulnerable children in to help them to develop a plan to get out of the house if there's a fire? Because they do that with older people, and I don't know whether they do that for youngsters.
I would say I'd have to say that the relationship with the fire service, out of our partners, the relationship with the fire service isn't as strong as your recollection is, Pauline, from 4 years ago. And obviously I've been in post 3 years. There's been some change of personnel. I did make links very early on in my tenure with the then fire service lead, and we did start off on a very good kind of footing. They've had some significant changes. My understanding is that they do safe and well checks. And we do obviously have contact with the fire service through our, referring into our service, and we have contact with all of our partners through our front door. But the relationship isn't as strong as you're stating there, Pauline. That would be true to say. That's not to say that we should pick that up again, because we should.
It strikes me that maybe then you need to have a visit from another member of the fire service to sort of update you. By chance, tomorrow I'm actually meeting the manager of the central hub, which includes Wokingham. So I will talk to him about this and perhaps ask that he contacts you, Carol, and arranges for somebody to visit and make sure that you know who you should contact and that he knows who the contact here is. I'll do that tomorrow, if that would be helpful.
It would be very helpful. Thank you, Pauline.
Thank you.
Thank you, Prue, please.
Thank you. Obviously, one of the priorities in here is children with special educational needs and disabilities, and you have got a separate SEND strategy underneath this one, which was co-produced and is very good. But a small spanner has been put in the works for that by the recent announcement that the DfE is delaying the school for a year, that we were hoping is a plank of our strategy going forwards. So I'm wondering what you can say about the implications of that, and also give us some reassurance about what will happen to the children who might have been expecting, we might have been expecting to go to that school in September. and what's happening about it? I know you won't be able to tell us everything, but what you can say would be very helpful.
So at the moment, we are in heavy negotiations with the DfE in relation to trying to resolve all aspects of the challenges around the delay in the school. That includes having conversations about alternatives for children. What we can assure the committee is that obviously we will do as we ordinarily would, which is we will place children in placements where their needs will be met, irrespective of the fact that that will not be in the new school now for next year. But we will still obviously do everything we need to do in relation to finding alternative provision where required. I can't really say any more than that, apart from the fact that we've got a project team. We're in contact with the DfE pretty much every day. We're having weekly meetings at very senior levels, and we are progressing. And by the middle of November, we will know more. So I can't. Apart from that, I can't, because I don't know. Because I don't know what the solutions are from the perspective of the DfE. That will impact on obviously our actions.
I think the thing I'd say about it, I appreciate the position you're in at the moment. I'm just sorry that all this additional work has landed on our Children's Services Department as a consequence of having to deal with the fallout from that decision and work out what to do. And I'm sure you've got enough to do and enough to worry about in next year's budgets without worrying about the additional cost of placements that you might not have been expecting, because we had a solution which was hopefully going to work for us. It's a great pity, but let's hope it can get resolved.
I hope so, and we're working very hard to get resolutions, but the children's needs will be delivered too. So that because we just won't compromise on that.
No, thank you.
Okay, great. It's a great shame that we're not going to have that facility at the time we expected. And Anne, I think you had your hand up, please.
Thank you. On page 24, just above the title Governance Arrangements, it's talking about breaking down barriers and silos in order to improve outcomes for children. So I wondered, have there been problems with different teams in the council, well, not cooperating, or at least, sort of having a mindset within their team? And have there been any barriers with systems and IT systems which have prevented cooperation across the council?
No to the latter. We haven't had issues with IT systems. We've got some systems that we're upgrading so that they're more fit for purpose. All organisations, such as local authorities, that silos is a kind of maybe overused word, but it's people have got their own remits. So because we are so regulated, and so therefore our operational model is very pre-prescribed in children's services, that drives different bits of children's services to operate within their own remits. And so what we've done with this strategy to kind of move us on as children's services from where we were back in 2017-18 to where we are now is to break down those individual kind of approaches to different areas of our work, to say, actually, where is it that we have crossovers? Where is it that, so for example, between in Heather's area and Adam's area, although Heather is working with mainstream settings and children with additional needs, some of those children with additional needs will also be looked after. Some of them will also be subject to a child protection plan. Some of them will also be a child in need. So therefore they hit Adam's service. So it's making sure that what we do in each of our departments is not counterproductive to the child's plans or progress or that sort of thing. So we're breaking those kind of departmental or divisional kind of barriers down, so that we're looking at children holistically and children's services as one holistic service. Children's Services was very traditional. You know, some years ago it had a very clear educational remit and a very clear social care remit. That's changing with the introduction of the Children and Families Act for children with additional needs. And so the playing field in terms of those sorts of very separate, those very separate kind of areas of business are now no longer so separate. And so we have to work hard to make sure that we are always looking to be holistic in our approach with children. And this strategy is really focused on that, so that we work as one department, and not only as one department, but one organisation. So where the organisation needs to support children, so for example, the infrastructure, travelling, you know, making sure that the children have got access to, bus routes and things like that. We also need to feed in the children's requirements, where we build new schools so that they're accessible for our care leavers, making sure their accommodation is accessible to, you know, a town so that they're not isolated. It's all of those sorts of things that we have now built into our kind of DNA, so that it's very much part of our thinking. So that's what we mean when we say that.
Okay, thanks very much. Thank you.
Just to add very briefly onto that, I think just as an outsider, as it were, something that's really struck me is how complicated each of the things are that each of the service areas are responsible for in their own right. There's a huge volume of them, as Carol said, hugely regulated, very prescribed. But something that we've done with this strategy as a process is organise all of those actions around priorities that bring all services together. And increasingly, Adam, his colleagues on the senior management team, Carol and so on, are having sessions across services and across different departments to figure out what they can do collaboratively, what they need to do individually in order to do the best for all children. Because there are some areas of overlap where social care and education overlap. For example, SEND is a good example, but it's not the only example of where those areas really do have to work together in order to do the best for the children and young people. So this strategy is basically designed around those priorities to actively bring the services together, not just at Adam's level and Carol's level, but at all the levels underneath. Yeah. On the IT systems, the only thing I would mention on that is something we are paying attention to is the sharing of information between agencies and partners and other teams. It's less about IT, it's more about culture, actually, and about sharing information about the children that we have in common and building the relationships so that we understand, you know, what we need from the schools, for example, what schools need from us, what health have by way of insight into the needs of children and young people that can be combined with what we know in order to actually just make more intelligent decision making. So that's less about IT per se, but it's more about the information sharing culture that is something that we're very committed to building. And I think Carol would support that from some partnership conversations we've been having, for example.
The difference between this strategy and the previous strategy, and perhaps previous strategies before that, although that was before my time, is that our service plans are aligned to each priority area. So we're working on the priorities as opposed to just individual service plans delivered by each department within Children's Services. We're collectively working on each priority with a strategic lead for each priority. So we know that we will therefore deliver the whole strategy for all children.
Great. Thanks very much. That was great. Thank you.
Yeah, great. Thank you. Can we move on then to the action plan? It's a very comprehensive document and full of actions. But I just wonder if there are any comments, questions around the action plan. Andrew?
Yes, thank you, Chair. And I do agree. It's a very comprehensive and very clear document. I have 4 questions, if I may. Firstly, Carol, you stated that the action plan is a live document, and I'm wondering, therefore, whether it might be possible to see individual actions RAG rated in future iterations. Second question, on page 12, there's a reference to seeking out and progressing savings and efficiencies. And Without going into huge detail, but I'd just be really interested in just a few thoughts about how this is actually undertaken. What's the process? You know, how does something get identified as a potential area? You know, where efficiency might be improved. What sort of criteria, you know, are used for identifying, investigating further or discarding, you know, such suggestions? So if I could deal with those two questions first, and then I've got two more, if I may.
Okay, so the first question about RAG rating. So our live interactive document does have RAG rating on it. It's on a massive Excel spreadsheet that can be interactive, and people could go in and look at their. So the strategic leads can look at all of the priority areas in that one priority. So they can look at all actions in relation to priority 1, for example. But service heads can then filter to look at their own actions for their own service area, as well as see the whole picture. So they can all see all the actions that relate to that priority for everybody in children's services. But in terms of delivery and looking at and scrutinising their own activity, they can filter in to get that by each division. And each of those actions have got targets. Each of them have got a RAG rating. But because it is a very complicated model to have brought to this evening that we would have to kind of navigate our way through and do a demo on, we've put it into the format we've put it in. But we can certainly give you an update on, you know, we could, if we come back, I don't know, in 6 months' time to give you an update where we are, we can certainly RAG rate the actions. That's not an issue. The second question about efficiencies and what criteria do we use? So we have a business case model. So, for example, if we have an idea, so an idea perhaps is, could we develop our own social work recruitment agency? And if we could do that, what are the requirements for us initially? How would we scope that out? What would we be looking to achieve? What do we think the potential savings are? How can we market that with our neighbours? And so it starts off as a kind of idea in relation to how feasible something is or isn't, how much upfront investment and time we need to put into it to see how much we can get out of it. So whether or not something's a go or a no-go. So we will do a little bit of work in relation to scoping something, and then we will make, and all of the governance for this all comes through our Getting to Good board. So we will identify a member of the team that would do the scoping. They'll come back and present their early findings. They will come back with any resource implications, because we have our transformation funding that we are able to support the kind of early ideas or pilots, and then the return on the investment. And that's how we then agree whether something progresses or doesn't progress. Compass team is a slightly different sort of thing. So, for example, we've just made a recent agreement to increase our Compass team. That's a bit more of an easy kind of calculation, because if one extra worker prevents one child from becoming looked after, we can calculate the investment and we can calculate the return on investment. So it's been efficient by being smart in the way that we think about things. It's looking at our contracting, looking at the way we commission things. It's a whole host of things that we have got as a kind of work package, if you like, to become more efficient and smart in the way in which that we provide value for money and excellent services for children. We don't want to compromise. Neither do we want to be kind of not maintaining our efficiency, but neither will we compromise children's outcomes.
Yes, thank you, Carol, for your answers to both of those questions. And specifically with this, and with the second question, I thought your discussion of the business case model and its use in scoping actions and so forth was really, really clear, and again, very reassuring. So thank you for that. Again, on page 12 of the action plan, item 3.7, there's reference to future development of a strategy to tackle serious youth violence, child exploitation, and extra familial harm. I'm just wondering whether there are any thoughts on a timetable, to develop that strategy. And then finally, on page 16 of the action plan, strengthening partnerships. There's a reference to CNDS and to West Berkshire Safeguarding Children's Partnership. Are there other partnership opportunities that could usefully be explored? I don't know whether it's appropriate for me to suggest this or not, but one possibility that came to my mind, would be with organisations such as First Days. I apologise if it's not appropriate to mention specific organisations, but are there other partnership opportunities that exist or that could be explored in future?
If I take that last question first, if that's okay, because it's very timely that you ask about extrafamilial harm, because we've just come out late earlier this evening, come out of a meeting between the lead officer and Matthew, who's going to support us with the strategy for that. So if we do that second, there's lots and lots of partnership opportunities, and we've just given a sort of snapshot in the action plan. So, for example, we have a Children and People's Partnership, which has got 4 priorities in its own right that the partnership drives forward. That is voluntary sector, police, health, both provider and purchaser, so the CCG and the provider of services. It's the local authority, it's schools, it's Health Watch. So it is public health. So that is a kind of, and we meet every 6 weeks. So, and I chair that. So that is a prime example of where we build relationships, where we tackle difficult things together that are kind of challenging us all. We just over the early part of September into October ran 2 systems leaderships events where we were looking to refresh the Children and People's Partnership, and we were looking at the priorities across the partnership and how we would reprioritise and give ourselves those set ourselves some key priority areas that we could absolutely drive forward as a partnership. And we had a session in October, and we've got another one in 2 weeks' time to really drive home some of those things that are very important across the partnership for Wokingham children. That's a Wokingham centric partnership group. And just for children. We also have the Health and Wellbeing Board, which obviously I'm very pleased to say in this new iteration has got 2 specific priorities for children. One is around children's mental health, and one is about the best start in life. So again, the Children and People's Partnership will be aligned to the Health and Wellbeing Board and deliver against those priorities they've already got action plans developed, and they will be delivered against. We've got the Berkshire Safeguarding Board, which is West Berkshire, Reading and ourselves. I also chair that. And that is about improving our safeguarding arrangements across the geographical patch. There's sub-regional and regional partnerships, so the Violence Reduction Strategy Group. I represent the Berkshire, whole of Berkshire DCS group on that board. So there's lots and lots of examples. We're just also kicking off a piece of work with the voluntary sector specifically for children with disabilities. So we're looking at a sort of consortium working with the voluntary and charitable sector to think about how we can improve local services, provide services by local providers for local children. So there's loads and loads of examples of how we have strengthened our partnerships, but we still have a way to go. Because we are small, we have to punch above our weight, and we have to really position ourselves well. So we've just won a bid from the DFE as a region, Southeast region, for a model to support our fostering delivery. And because I chair the fostering network for the Southeast region, I put Wokingham forward to host that. So it's those sorts of things where we've got to really position ourselves very strongly in that partnership landscape so that Wokingham children get the best opportunities from any partnership working. So that's our approach really, is to be a bit sharp-elbowed to make sure that we do actually benefit from any partnership working. It really benefits Wokingham children. I hope that answers your question. Andrew and Matthew, I'm going to ask you to answer the question, because I know you had a meeting earlier this evening and you might be able to give a bit more detail.
Yeah, so it's a very, very timely question for the reason that Carol set out, which is why we were smiling about it. So the timescales are that we want to develop that strategy between now and the end of the financial year. There has actually been a huge amount of work already completed, I think it's fair to say, in relation to violence reduction. There's a staggering number of different partner agencies who need to be involved in that work. So, you know, the police are very much a key stakeholder, health a key stakeholder, education a key stakeholder, and there's been a lot of engagement with those groups already. What is happening now is the pulling together of the outcomes of all of that and shaping it into a set of strategic priorities, which will be work that takes place between now and the end of March. I think there are possibly some questions for the committee about at what stage they may or may not want to see some of the work in progress around that. This conversation, I think, is a really good example of where we do like to come, I think, Carol, to this committee, where, a stage where strategies are quite advanced, so that there's something to actually talk about, but not complete, so that the committee has an opportunity to give views and steer the final stages of development. So we might want to think about that timeline if it's appropriate for this committee for that particular piece of work.
Thank you, Matthew. Adam, do you want to add anything to that? Because I know that you're also heavily involved in the violence reduction work.
Nothing really further to add, other than we are meeting with the police in relation to violence reduction agenda and how we're looking at that. And at the moment, we're doing work in terms of scoping what those particular issues are across Wokingham, and that's the work that's currently taking place to inform then how we move forward with that role and function.
Thanks, Adam. Thank you, Matthew.
Thanks.
Great, thank you very much. Any further questions on the action plan? Anne, please. Sorry, you haven't switched your microphone on.
Sorry, page 29. I just wondered, it's the section, it's underneath SP4, the blue box, and it's talking about investing in supporting staff. And I was wondering, is a lot of formal training provided for a council staff in this area, and what sort? And do staff achieve professional qualifications through such training?
So we have a very, very comprehensive learning and development offer. It was cited in our ILACS revisit as being a real strength. So we've worked really tirelessly over the last 2.5 years, I'd say, Adam, isn't it, that to really ensure that our workforce have the right training and learning development offer to ensure that they're delivering the services that to our children that you know, that they should and that we want them to. So we do. There is obviously there's an organisational L&D offer, but children's services and adults actually have to have additional over and above that, because we have so many statutory requirements. So, for example, in our Learning and Achievement Partnerships division, we have our educational psychologists who have a high level of CPD, continuous professional development requirements. So we have to provide opportunities for them to be able to keep their continuous professional development up to date. In the world of social work, all of our social workers are registered with Social Work England, and there is a requirement for them to update their continuous professional development record, otherwise it compromises their registration. And in fact, there's a deadline of the 30th of November for us all, because that includes me, to update our continuous professional development to continue our registration. And we have to register every year too, so we have to reapply every year. So we have an obligation to provide that training, that relevant training to our staff, and we align it with all of the standards that are within the framework, the Social Work England framework. We provide opportunities through a kind of checklist, and we give our staff 2 weeks' time, we've got a practice week. And within that, we have provided a continuous professional development feedback document that our staff can use and then upload directly onto Social Work England. So we do a massive, massive amount in this space, and we've been highly commended for it. I think we have a very, very good offer for our staff.
That's excellent. Thanks very much. By the way, I can see there's an awful lot here. It looks very impressive. Okay, page, oh, what is that page? Sorry. You look at page 31, item 110. It's talking about audits. I was wondering, are those audits available? Because one was due at the end of June. Or is that an audit available?
Well, they're obviously they're on children's records, and so therefore the information is confidential. We can certainly share the audit. So we would, when we've done audits, we have an audit report that goes to our Quality Assurance Board, and that would give a general overview in terms of the number of cases we've audited, the number of cases that have been deemed to be, you know, using Ofsted framework good or outstanding or requires improvement, etc. We wouldn't and couldn't share the detail of the audit because obviously that's got confidential information about children. But we could give an overview in terms of how many audits we do in a particular cycle, that sort of stuff. That would be acceptable, Adam, to do something like that, do you think?
I think an overview of audit activity rather than the specific detail of the sort of maybe the themes we've been looking at as well, because we plan out the themes. So we have two different sorts of audits. We have core audits which take place regularly across the system, and we also have themed audits that pick up on a specific theme. And that may be because there's an area that's come up either in a complaint or an area of learning that we want to look at, and then we specifically focus on that area with a core audit.
Or we do, and that the thematic audit may be about a particular service area as well. So we might audit.
Sorry, yeah, thematic audit. I said quality.
So we might audit a service, or we might audit a theme. We might audit something like neglect as a theme, or we might audit the children with disabilities team because we want to ascertain whether there's been an improvement from previous audits, let's say. So that's a thematic annual cycle. And then, as Adam says, we also do core audits, which is an activity that we do on an ongoing basis.
All right. So are there any actions from these audits? Are they also confidential?
I would say some of them are specific to cases, so they probably would be. But if there's a general learning theme, because obviously what we want to do is complete that loop, so the outcome of the audit ensure that activity or action is completed on a case, or the learning is taken if it's a general theme or topic that we feed that back into that learning and that cycle that then carries on. And sometimes what may happen is, like Carol was indicating, we may look at a specific team and do an audit, then we may revisit that team a number of months later so the first one was considered as a benchmarking, and the second one then goes in to establish what's happened in that interim period.
And so obviously what we do from that is we take the learning. So say something particular comes out of a set of audits, we might then put on a particular learning and development offer to improve what has come out of the audit. So, for example, we do something for children that are called safety plans, which is where we build a plan with a family. If we find that the safety plans are not where we'd like them to be, we would do some training to strengthen our social workers' knowledge and skills in relation to safety planning. So that's how we close the loop.
And then obviously another function of those audits is that we keep a record of the audits that are completed. And when we get a phone call from Ofsted, they will then ask us for a number of our audits as part of their early work they do in terms of preparing their lines of interest they may be looking at across the local authority when they're doing their full inspection or focused.
I see. Thank you. So so it sounds as if when there's a theme, it will be fed back into the system.
Yeah.
But it wouldn't in a normal way, it wouldn't necessarily be reported to a committee. Councillor Timothy.
So sometimes just on that point, so with the corporate parenting board, if there's a specific area of audit that's been undertaken in, say, for care leavers, then the outcome of that detail is shared with the corporate parenting board, and that plan or action that may be following that has been shared at there. That's an example that's happened previously. But it doesn't go into the detail of young people.
No.
It talks about those general sort of areas.
I see. All right, thank you. Okay. Sorry. Okay. Page 32. Now, I was wondering, item 1.1, elective home education, and this is about ensuring that all children have access to quality education. Is there a sort of idea in mind of what form that would take?
Right, I see. Sorry, that just for clarification on the committee, that's actually a formatting error. It should be, I think, 1.18, but it seems to have been missed off.
Oh,
people are looking for it, but that's the error of the printing press, councillor, not your error at all.
Okay.
This does actually just from my knowledge of this is come out of the conversation with the Education Welfare Service, and it actually does relate to the children missing from education conversation. That was the item before this one. Essentially, there are a community out there where the service itself is a little concerned, to be honest, about ensuring that the children have the right level of support to education that they need. We have to be very respectful of parent choice. We also have to be very respectful of the decisions of that elective home education community. So it's a tricky area to navigate. But at the same time, if we took the Gypsy Roma Traveller community, and there's an action just above that that relates to that community, there are some concerns on the part of professionals that we're doing enough to ensure that those children who are educated outside the school environment, but actually perhaps aren't receiving the educational support in the home environment, do not absolutely slip through the cracks. So actually it's that action sort of refers to managing that conversation in its broadest way, in a way that leads us to do the right kind of sensitive but appropriately targeted work for those children. Again, it's very much in the spirit of the all children and young people in Woking and receiving the educational outcomes that they deserve, and that we do the best for them. So that's what that refers to, councillor.
I see. So do you have some materials in mind, or perhaps it would have to be very individual what was provided? Because presumably you have something in mind to boost the children's education.
So these are children that are electively home educated, so parents are making choices, by and large, parents are making choices to electively home educate their children. And so we make contact with all of those families. There is no legal responsibility on those families to allow us to work with them, or we would like to go in and assess the learning environment to make sure that those children have good access to all aspects of a curriculum as they would in a school, but parents do not have to agree to that. No. By and large, they do, and we know and have are in conversations and discussions with the vast majority of parents who choose to electively home educate their children. But we don't. It's not the local authority's responsibility to provide the materials. That is right, isn't it, Heather? I'm going to refer to my educational colleague now.
Yes.
Thank you, Heather. Just wanted to check. I wasn't getting off piece.
That is correct.
Thank you. So yeah. So it's more about us having an advisory and supportive role to, as much as possible, to ensure that the parents of children who make choices to electively home educate their children are providing an enriched educational offer to their children that would sort of be akin, if you like, to them being in school. So that includes things like leisure activities and those sorts of things. But parents are not obligated. There's no legal requirement of a parent to tell us. We just hope, working with them closely and being supportive, means that they do, and the vast majority do.
I see. Are there any cases where parents would be happy to receive materials of some sort that they could be pointed in the direction of, or does that not really figure?
I suppose if they asked our advice directly, then we may be in a position to kind of have that conversation. But we wouldn't know of individual cases necessarily.
No. Okay. Right. Thank you. So this is page 30. Is it same page? Page 32, item 119. When is the first useful monitoring data and information expected to be available? Because I think, actually, it's not till next year, really, is it? To do with the alternative provision of the children.
It's into 2022. That's correct.
Right. Yes.
It's around that time. Yeah.
Oh, I think what I was thinking was, does that mean some children will be waiting a long time?
No, it's not. It doesn't relate to their provision. It relates to the reporting of progress in relation to their provision. So we have some children that are have alternative provision, and we want to make sure that those children don't fall through the gaps in terms of achievement and outcome. So it's making sure that the implementation of our alternative provision targets vulnerable learners, and obviously has demonstrable improvements in the outcomes. So it's trying to make sure that those children that are not in mainstream school and are accessing alternative provision have the same quality access to the curriculum as children that are in the mainstream provision.
So they could well be at the moment, but sort of thing. But the scoping of it won't be known until later next year, or rather the full understanding of it.
And outcomes won't be known until next year.
Yes,
because
that's what I'm trying to say.
Yeah.
Okay. Page 35. Done it. So it's item 2.5. Systems are improved and developed to support the agreed service priorities, Mosaic. So what is, I haven't written my question very well. So what's the difference now in data quality for children in the updated Mosaic? What benefit has the updated Mosaic provided?
So we're improving the system all of the time. It's our main social care. Well, it's our only social care system. So all of the recording for all children in our social care department, we use that recording system. So it's just making sure that we continue to improve it. So when new versions come out, we get on the latest version. When there are new things like family work so new modules that we are ready to implement new modules, that we update and refresh the system readily. So it's just an ongoing improvement of the system to make sure it is fit for purpose. If we need a new report, that we write a new report and it gets built into. If we want to develop a new form, so that we can record things. So, for example, in relation to our practice model, we have specifically designed forms, but we've got to build those forms, then we've got to build them into the system, then we've got to test them. So there's all those sorts of things. So it's just ongoing improvement so that we get the most accurate data that we can on our children, and that we're able to use our data intelligently, so that it's a management support tool, not just a data warehouse.
I see. Thank you. Said that you did an upgrade to the latest version by May. So did that have any particular features that you can describe?
It was just a latest version. So we have to keep it. If we're not up to latest version, then it means that the system doesn't work as well as it should. it can have glitches and things like that. So we've got to keep it up to date. So we have to go on to the latest version, but it's a bit of an undertaking when we have to go into a version, because we have to close it all down. We have to get everybody to store their data. We have to have a cut-off point. Then we have to update it. Then we have to test it. Then we have to go live again. So it's just it's not necessarily any improvements. It's stability of the service, stability of the system. Sorry.
Right. Okay. Yeah, I understand that. Yes, and I can see that an update has quite an effect on the staff, doesn't it? But
it does. Okay. We'll do it over a weekend.
Ah, right. Okay. Thank you. Silly little question. What is Power BI? That's
it's not a silly question at all. That's it's a very interesting one. It's a really useful tool that helps to improve the quality and the clarity of management information. So the way I think of it is that it's just like a much friendlier, more presentable version of Excel, in the sense that it makes charts easier to read. It kind of breaks out the graphics in a more appealing way. It enables services to plug in lots of different types of information and get quite useful analytical reports, I think, relatively quickly by comparison to having to go on an Excel training course and learn, reams and reams and reams of that kind of thing. So I'm hoping that the council and this committee will see the outputs of Power BI as Wokingham continues to progress and develop around that. I understand it's a corporate project being taken forward corporately, so it's with them to roll that out. But hopefully, we're hoping that's one of a number of tools that staff will be using across services in order to help present things like data and management information in a increasingly accessible way. That would be my hope, and I can attest as a user of it myself that it can be very useful and powerful.
And I'm so pleased that you articulated that, Matthew, because I know of it and I know what it's supposed to do, but I couldn't have put it as eloquently as you just did.
Well, hey, you're either in the club or you're not in the club, Carol. What can I say?
Well, clearly I'm not.
Okay, thanks very much. That'll be good when we see these girls, won't it? Yes. Gosh, page 38. Oh, I think that's what I mean. Yeah, sorry. Page 38, item 221, using the Getting to Good platform to ensure that outcomes and delivery from strategic priority to sort of relating to strategic priority 1. Have the quarterly reports shown these constructive interdependencies as yet?
Sorry, which item was this? Sorry, Councillor. Which?
Sorry, yeah.
2.24.
2.21.
2.21.
Okay, that's.
And so talking about
yeah.
Adult
there are some there were quarterly reports concerning you're wanting effective interdependencies between strategic priority 2 and strategic priority 1.
I see. Yes, that's a little bit technocratically strangely worded. Essentially, the thrust behind that, and the answer is no, that hasn't yet started. It will do once the strategy goes live. But everything that's in priority 2 is very much to do with making sure that decision making is evidence-based, that there's quality data and information that actually empowers decision making. And everything in priority 1 is very much about the models of delivery that we develop and adopt. So thinking behind that action is to make sure that all the things in priority 2 about improving data, improving evidence, improving the quality of evidence-based decision making is actually used to help with priority 1, so that the models that we develop are based on evidence and the kind of business cases that Carol was talking about. And that they're not based on anecdote or gut instinct, but local intelligence and data. So the answer is that's not in delivery yet, but would be once the action plan and the strategy are actually in delivery. That's something that we will monitor through Getting to Good.
That sounds excellent. Thank you. Just see if I've got anything else. Oh, sorry. Oh, yeah, okay, I'll finish there. Thank you.
Okay, thank you very much. Anybody got any questions on the governance arrangement section of this report? Rudy's favourite subject. No, there seems to be no questions. So thank you very much for that report. It's provoked a lot of discussion. So thank you, and all the best with taking it forward.
Thank you.
Thank you.
So we'll move on then to agenda item 28, which is the Children's Services Performance Indicators. I don't know, Carol, if anyone's going to say a few words at the commencement, or if you just want to move straight to questions.
So we don't have our data colleague with us this evening. Unfortunately, she's unwell, and her manager's unwell as well. So Adam and I are going to tag team and try to answer your questions as effectively as we can. So if you want to just go straight into questions, it's the usual format. So it's the same as we present every time. So I think it's okay without an introduction, Chair, because it is the sort of normal format, if that's okay.
Yes, I think that's fine. Thank you very much. Questions, people? Andrew?
Thank you. If I may jump ahead to dashboard item 3, that's okay. So this is the Children's Social Care front door. I've got 2 questions in relation to this. Is the volatility in terms of front door quarterly number of cases progressing to an assessment seen over the past year typical? And how do you account for that? And secondly, haven't met the target of 90% of assessments being completed within 45 working days in any quarter this year. Note also that the actual figures in the borough have been below those for the England average and of our statistical neighbours. So my question there is this 90% a realisable target? Are there any factors specific to Wokingham that are frustrating this?
So just going back to your first question, sorry, could you just restate your first question? I believe it was in relation to the numbers of contacts progressing to assessments, was it?
That's right, and it seems to be quite volatile numbers. And I'm just wondering whether...
I think what we're very aware of is now over the past 18 months, it's very difficult to arrive at a clear view around the impact of the pandemic in terms of the numbers of contacts and that are progressing. So we do talk to our neighbouring authorities to understand their perspective, and often they can be quite different or they can be quite similar depending on which authority we're talking to. What we have noted is that the contacts, so whilst the contacts have gone up and down, and we're keeping an eye on those and tracking those, what we have noticed is a number of contacts that are progressing to an assessment. So that's what's called a referral, which is an assessment, has reduced. So that gap, when you look at that, the contacts is, I think currently in this current period, is increasing, but the number of assessments is reducing. So it is something we are monitoring, and we are going to look at in detail just to understand that a bit better. And in relation to the second question, which was around the number of assessments completed in time frame. So this is something we are aware of and we have been looking at. There has been a lot of work in terms of we've been clearing we've been closing a number of assessments that have been open beyond timeframes within Q3, and we feel that's Q2, sorry, which we believe has had an impact on that number. And we've also put some narrative in there when we were looking at to understand that in relation to the impactors on that, in relation to as we're exiting the pandemic, and there is recorded there around staff sickness and the impact of as we've been exiting. But we are looking at that to understand those that some assessments do progress beyond 45 days where that's felt to meet the needs of the child or the assessment, or where there are other complicating factors. And what we mean by that is where there may be a child protection inquiry that's running live with that, or we may be entering court proceedings and other activities are progressing. But you're right, you highlight that we haven't achieved a target. I think that's a valid point around whether that target is achievable or whether the target is too high. The bit we're focusing on is the UK average in terms of 84%, I believe it is, of assessments.
Okay, thanks for those answers. Is it okay for me to ask 2 other questions? Yep. If we go to item 4, as an example, and that's referring to child protection. I note in the last line, for instance, the percentage of child protection visits within timescale, and this is a pattern that's repeated in a number of other tables, that quite a number of the tables refer to small decreases since the previous quarter. But in some instances, like in the last line of item 4 here, the decline has been quite significant over a number of quarters. So there's a 4% fall in child protection visits within the timescale Q2 to Q1, but it's a 10% fall when compared to Q2 a year earlier. And this is a pattern that's repeated, as I say, in a number of tables. And so my question here, possible suggestion, is as we gather more data, and I do find these tables are very, very user friendly, and so what I'm suggesting perhaps, wouldn't actually involve a significant, any significant, amount of additional work. But I'm just wondering whether there might be any value over time in adding additional time series data, perhaps for the previous 4 or 5 years, not for every single quarter, but just the yearly average as that data becomes available, so that we get a better picture of annual trends. That's just a suggestion. Item 5, the trend is, which is referring to children in care, and I'd be particularly like to focus on the last line in that table, where it seems to be that there's been a significant increase in the number of children allocated more than one social worker during the previous 12 months. What's the most likely reason, or the most likely trajectory, let's say, for this in the coming year, and why? Is this like, might not be fair to ask this, might not be possible to answer this question, but is it possible to make any forecasts about what might be happening in the coming year, and if so, why?
I think this table is an interesting table, and it raises some interesting questions. And what you're asking is something we've been asking ourselves and looking at it. And I was looking at this particularly to understand the significant leap from Q1 to Q2. What I can tell you is that table is cumulative throughout the year. And what we track back when looking at that to understand that change is that there was, so for example, within that this is within the looked after team, there was one social worker who progressed to becoming an assistant team manager. Now that progression would be seen as a positive in terms of their career progression. They've been around a long time, they bring stability and knowledge. What you have though is then a knock on that role no longer holds cases, and those cases would be moved to another worker within that team. And that would see, what you would see there is that significant impact, because we were wanting to understand what was the narrative around that, to try and understand that in a bit more detail. So there will be aspects of that. There will always be a percentage there, and it will always probably move up and down. How much of that is within our control is the important part, to ensure that our system and the way that we operate doesn't influence that. The part that what we always look at in children's services is how to avoid what we call the handoff of cases, where you move cases between workers, and how you reduce that as much as possible across the system to provide that stability that children have with their same worker, to avoid the repeating of the story in a narrative and develop those relationships. And whilst that's a positive of having a looked after team, is you get those long-term relationships. Because that team is small, it will always be vulnerable to those changes. So one worker change, if our looked after children population is just over the hundreds, the percentages become quite easy. One worker leaving will probably add a 15% swing to that, as those cases then have to be reallocated.
That's really helpful, Adam. And the examples that you cited have made my understanding much better. So thank you very much.
Okay. All right.
Oh, thank you. Yeah, I struggle with these. Dear, dreadful. Talk about getting entrammelled in your mask. Could I ask a question about dashboard 1, please? I was just interested that the current ECHPs placed out of borough seem to be on a rising trend. And I wondered if that continues, well, firstly, whether you have any idea as to whether that might continue. And secondly, what the financial implications of that could be. Thank you.
Is Heather, are you able to respond to that from Education, or Carol?
I'm here. Yes, well, that brings us back to the conversation we were having earlier that was around the Oak Tree Special School, doesn't it? Demand is increasing, and that is a trend that's happening across the country as well as in Wokingham, and that will be why the numbers are going up, because we have yet to secure the places that we need for that specialist provision in Wokingham. Carol, do you want to say anything a little more maybe positive than that?
Yes, but sorry, Morag, I had to look at an urgent email, so I did miss some of the question. So if you wouldn't mind just asking or saying again, and I'll do my best to.
Oh, no, of course not. I was just wondering, firstly, if it's likely, if you know that this trend is going to continue, and if it does, what are the implications on the finances? Thank you.
We're doing a huge amount of work with our schools community to support our special education needs coordinators in schools to help them to understand their responsibilities and to work with children at an earlier stage so that they don't escalate to a point where they've got an educational, health and social care plan. We have done some projections moving forward, and when we have our graduated response up and running, and that's a piece of work that we're doing that will be fully implemented by March, we do have some insight to say that there will be a levelling off, should be, with all of the different preventative measures that we're putting in place. There should be a levelling off of the increase, and we should be able to work with children potentially at a lower level. But it's a very complex picture. It requires lots of different bits of the system to come together. All authorities are in, as Heather said, all authorities are in the same position. The implications of the Children's and Families Act of 2014 was underestimated by all authorities and not really not really thought through in terms of the implications of the additional duties and therefore the additional financial implications on authorities. So to increase responsibilities from 18 years to 25 years was obviously going to have some financial impact. So it's working through all of those things, and it's a national challenge. And we are, lobbying to make these things known so that the government understand the complexity of this area. It's more difficult to do what we might call traditional early intervention and prevention work, because if a child has a disability, they have a disability. And as they get older, generally speaking, that disability gets more complex. If we think about a young person with on the autistic spectrum, particularly adolescent boys become, and it's a generalization, but we've evidence to support, obviously, that young adolescent boys growing into young men with some forms of autistic behaviour are very, very difficult to manage, and their needs escalate, and their level of support requirements escalate, and that costs money. We're working very closely with our health colleagues to try to ensure that all packages of support are funded fairly and equally across a child's needs, because a child often has multiple needs. They might have social care needs, they might have educational needs, and they might have health needs. It is definitely a challenge, and there is no easy solution. I wish there was. It's an ongoing challenge that we're addressing. We are at the moment working on our high needs block recovery plan, but it requires a number of strands of work. It isn't just There isn't, unfortunately, one sort of silver bullet that would fix it. So it's coming together, making sure that all the work strands are all pulling in the right direction, and knowing our community, building our sufficiency. It's supporting our schools, ensuring our schools are working as inclusively as possible. It's just a very complex landscape. So we're doing everything that we can in the here and now, and we're planning for everything that we can do moving forward as we get more provision online, as our resource bases have been reviewed, as we have a new provider in Chiltern Way that is just kind of finding its feet. That was a previously Northern House school. We've got, we've got a new resource base coming online. So there are some indications that we will manage this moving forward. But as we've discussed, the situation with the new special school, it is obviously stepped us back a bit. So we're looking at contingency at the moment. It's a very, very complex landscape. I wish I could give you a easy answer, but I can't. I'm sorry.
No, that's very thorough. Thank you.
Thank you. Prue, I think you have your hand up.
Yes, I do. I want to talk about item 2, if that's okay. As a quick point first, which is I think the commentary is slightly wrong in that it says the length of time taken to complete an assessment has improved compared to the previous quarter. I think that might be left over from last time because it's actually gone up slightly. But I wanted to ask about the fluctuations in the number of referrals. And is there a reason for that, or is there a seasonal reason, or is it COVID related, or what? Because it does seem to fluctuate quite a lot. And I wondered if there was an explanation as to why that is.
I think it's fair to say that one of the observations we had earlier as we were leaving, I suppose the height of the pandemic, was that our early help referrals were increasing. And that may be reflected there in Q1 in terms of that higher number, that Q2 would have struggled to compete with that due to that high level. But we are still seeing a high level of referrals, even though it's lower than the previous quarter if you look back at the earlier quarters. But of course, those earlier quarters now sit within the pandemic because this is now looking back over that period. But it is something we're aware of. And when the answer I was giving earlier, looking at the number of contacts, so of course, as a contact comes into the front door, as we describe it, and that contact doesn't progress for an assessment in social care, that contact may be signposted to the early help hub and therefore going into early help. So that's part of what we're looking at, is that bigger picture in relation to where work is going as it comes in or flows in. If it's not progressing for an assessment, is it going to early help? But it's something we are very conscious of in terms of that increase in numbers, and that's why thank you for pointing out about the narrative there. We'll look at that, but we're still completing assessments within a time frame that's appropriate, even though there has been that increase.
Yeah, no, I wasn't particularly worried about the increase. It's just that it ought to be accurate. That's
no, I completely concur.
It's still below where you were, but it is. Do you think it's continuing to be higher than it was before the rate of?
I think it's very easy to have anecdotal sort of responses to this, and we obviously want to apply lots of caution to doing that. But I think it probably is. I'll do it anyway. It's fair to say that I think that there are probably cases or situations being referred to early help that are new and probably wouldn't have been seen pre-COVID. Okay. in terms of the challenges or the support that is going through that into that service.
I suppose the thing to keep an eye on is whether that eventually the early help actually does prevent that escalating, or whether we.
Of course, because that's central, I suppose, links very much that conversation earlier about preventative services around that, supporting families earlier in terms of preventing needs escalating and requiring more of a statutory specialist service. Yes, definitely.
Yes. Yeah. Okay, thank you.
Thank you. So looking at dashboard 3, which I haven't got in front of me, I just wondered, it says there's been an 11% decrease in the number of contacts. Is there a figure available for the number of contacts? That's something that is reported
Sorry, I just switched off my. It's not covered in this data set because obviously the top one is those that progress for assessment rather than the actual number of contacts that come in. That's not covered within this data set.
No, but is it available, or could it be available?
We have the data. I don't have it to hand now.
Okay, right.
It's part of that data that's relevant that we look at in terms of understanding what's occurring in terms of activity within the MASH and front door and then the duty triage and assessment teams.
Yes, yes, quite. Yes, thank you. And then the other thing was in item 7. Oh, here we are. So nearly at the bottom of the page of 62, the number of children, not currently on a school roll has increased in the second quarter of 2021 to 22. So is it known where they all are? So I mean, do you know, we've got so many children who are registered to be learning at home and so many in other places. Do you know where all the children not on a school roll are?
I would need to defer to my education colleague, Heather, there. And you're on mute, Heather.
Oh dear. We should be able to know where they are, yes. Although, sometimes with children arriving, new arrivals in a local authority, there's always a little bit of opportunity there for us not to know. But where they should be on a roll, we should know where they are. Yes, that's the whole point of the children missing education statutory responsibility of the local authority.
Yes, quite. So, I mean, do you keep that figure in mind? Are you sort of monitoring that? Whether there are any discrepancies? Well, presumably it should all add up. The children missing education and the children in education and all the other groups that you know about. It should all add up to the same number. Are you sort of? It should add up. Yes.
Are you
monitoring whether it does?
Yes, and if it doesn't, we then make sure that we make sure that we understand why it doesn't, because then obviously we're not getting the information we need, because the information has to come into us. We don't hold it all. We have to rely on our school colleagues and tracking our children who are in alternative provision, tracking our children who are electively home educated, etc., 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 tracking our children on AOTUS packages. So it's a whole raft of different provision that our children access, and if we see any kind of data that says, oh, hang on a minute, these things don't correlate, then we would obviously do investigation into the area we need to ascertain why the numbers don't balance. But we do track every single child. We track every single child that is not in school. We track every single child that is in alternative provision. So we have, we do know where our children are, fortunately.
Right. Thank you very much. That's what I was wondering. Thank you.
Thank you. Any other questions from anyone? I was just Sam, go on.
Thank you very much. Yeah, my question was more following on from Anne's question. It'd be really interesting to understand if a child's taken out of, say, education, and let's say you follow up with said parent or said carer, and that they're told they're being homeschooled or given another provision of education. How is that tracked? And is there a way the local authority is ensuring that if they're told a certain child is being given another provision, that has actually been the case? Just thinking out loud, I mean, my concern or worry would be that if within this, if a certain child leaves these stats and ends up leaving education, or there's things like, I'm just thinking, they could be taken abroad, or they've just gone missing, or things like county lines where they're trafficked to other areas, and I think people can go missing. So it'd be really interesting to hear what's being done to tackle that.
So that's a multi-layered question, because it crosses over several service areas. In terms of children moving off role and onto a role to another school, that we have something called managed moves. So children will go off one role onto another role. If a child moves out of provision into our pupil referral unit, then they're either held on role in their mainstream provision and whilst they've been worked with, if they're going to be returned. If they move schools, then they obviously move roles. So are a great source of intelligence and information. And if they are worried about children that are that have kind of just suddenly are not in, obviously we will be informed in relation to that, and then we would be working collaboratively to do that. Where it concerns children that are more vulnerable and children that may be at risk of not attending school, then obviously our children's social care service tends to be working with those children, and we would track those children through different parts of our service. So I can't. It's a multi-layered question that hasn't got a simple answer, because you've asked us kind of about children going missing from school on a kind of ordinary basis, and then you've asked us about children in terms of county lines, and that's a very, very high level intervention and part of our service. Sam, if you want to ask me that question, it may be easy for you to put what you would like to understand in writing, and then we can work through how we give you the right answer, because then we can talk to the right people in the department to ensure that we give you a full answer. It's a bit complicated to try to answer it verbally.
Thanks, Carol. That's really, really useful. I think, yeah, and I'm in agreement with you. It's a very complex issue. And I think looking at this, often, probably as you would agree, I think the first time someone can see there's a problem is if a child leaves school or is not attending. It's often the first sign, isn't it, that something's wrong. And no, I agree, it's a multi-layered and multi-agency solution. But yeah, I'm happy to get something to you in writing.
Right, thank you.
I was just looking at the care leavers, and it's very encouraging the number of the care leavers that are keeping in touch with us. I think that's almost say a lot about the service and the interaction with these people. It's also interesting to see that the percentage that are not in education employment has gone down. Is there any backup information on that? Is that increased employment or increased education, for example? Anything further that give us an insight into that, please?
I think it'd be difficult to give the specifics of what that is, but what I can say, going back to the in touches, is obviously that's a benefit of that relationship that our personal advisors have with those young people that have left care, which will be key to supporting them and encouraging them to engage in education or employment. But it'd be difficult to give you that split. I don't have that data in terms of what that split is on that increase.
Okay, thanks. Yes, it is very encouraging to see the number still in touch. Says a lot about the interaction, which is great. Any further questions on this report? Not, then thank you very much for the report and the replies. And we'll move on to the final item on the agenda, which is the forward plan, which takes 65 onwards. Those with a keen eye will see that the forward plan has changed quite substantially. Carol and the team have gone through the forward programme and added a significant number of items. Do you want to say, Carol, how you went about this? That would probably be helpful rather than me trying to say. Thank you.
Yeah, that's fine, Chair. We've taken, I don't think it was in our pack this evening about the strategy, but along with the strategy, we have a very tight delivery plan. And on that delivery plan, we have got all of the different items that we are working through and the timelines when either those transformation pieces, those strategies, those policies, those projects are being worked on, and then when they're at a stage where we think that as Matthew said, alluded to earlier, where you have something meaty to kind of ask us questions and scrutinise us on, but it isn't a foregone, fait accompli. So we've tried to look at that timeline and then map that against the timeline of the ONS committees, so that you have got access to those items that are part of our Getting to Good board and our timeline in a timely fashion for you to have the opportunity to have oversight and scrutinise before they become kind of, embedded into our timeline. So that's what we've done, and they are the kind of big pieces of work that we are looking at over the next. Well, we've gone right through to next November. We have left some gaps, Chair, as we discussed, so that if committee members want to ask, for some specific a specific update on a specific issue, providing that we feel that we obviously have got sufficient evidence or information to be able to share and have that discussion, there is room, I still think, on the plan to add things as members would like to. But that was our rationale, and we wanted to give you a good flavour, if you like, of some of the work that we're undertaking and some of the things we thought that would be of interest to the committee.
Great, thank you very much. Yeah, that's great. So are there any specific points on the forward programme, maybe starting from January onwards? Anything? Andrew, what was your point relating to which part, please?
Well, it's not specifically related to January, because I note that January is already a very, very full, likely to be a very full meeting. But earlier we discussed, Matthew discussed the strategy to tackle serious youth violence, child exploitation and extrafamilial harm, which he said is under development, at the moment. And I think it would be really good if it was possible to come up with a timing that would allow the committee to have some input into that, the development of that strategy, a later sort of draft, of the strategy before it's actually presented in for final approval. So that was one suggestion. I would imagine that is something that would need to be done relatively early on, in this forward programme, but probably not in January. I did have one or two other suggestions for items that might be considered.
Can we take them one at a time? Just
yeah, sure.
Get Carol or Matthew wanted to respond to that first point.
So yes, we because the law has changed in relation to the extrafamilial harm and violence reduction, we are on a bit of a tight timeline in terms of having to turn around and have a kind of working strategy. Now, because their meetings are in January and then in March, we are looking to have it sort of as a complete document, but certainly a first version by the end of March. So we might just squeak in if we do it in March before it's absolutely finalised. I don't know what your thoughts on that are, Matthew, but January might be a bit too soon in terms of its formulation. But also, as you rightly say, the agenda for January is full, and we felt that those things were relevant for the January meeting, and to slip them would make them more irrelevant, and therefore So I don't know what your thoughts are, Matthew, in relation to the March date.
Appropriate draft 2 should be drafted around February, that February to early March period, because this is very tight turnaround to get that then signed off.
Sorry, Matthew.
Between mid-March and end of March.
You're breaking up, Matthew.
It would actually be if you can hear me.
You were
I'll
breaking
send
up.
a
We
message
didn't
to
hear you.
Carol.
He's going to message me.
Okay, thank you.
There you go.
Early March, he says.
Okay.
Yeah.
Seems
So-
like March might be a suitable time then.
I think, and Adam has also messaged me to say that we could perhaps switch it out for the fostering item, because the fostering item could be put back to May, which is a lighter agenda.
Okay, that makes sense, I think, yes.
Okay, so if we move the fostering transformation down to May and we put the extrafamilial harm strategy in March.
Okay, it's fine, thank you. Andrew, you had another couple of points.
Yeah, I note in May of 2022, was education update, looking at developments relating to education and learning achievement and partnerships. Now, in the action plan for the Children's Services Strategy, there's understandably important references to narrowing the gap in educational attainment outcomes. I'm just wondering whether, given the importance of that, whether it might be possible, whether that would be included in that education update. That specific item would be a part of that education update.
It can be, if you want to put that, if you want to, if you put it in writing to us, Andrew, then we can make sure that we include it. Then we won't forget. Yeah.
If everybody's happy for us to do that, or
Nobody seems to be objecting. There's a couple
Okay.
of people nodding, so we'll take that as yes.
thank you. And just one final suggestion. I'm just wondering whether at some future meeting, whether we might be able to obtain a report on children affected by domestic violence. It's something which I think is a considerable concern, which I don't think we've specifically looked at for some time.
It depends on, so it's difficult for us to produce some a specific bespoke report in relation to that, because the domestic violence strategy isn't a children's services strategy. It sits with the community safety partnership. So it depends on what it is that you would want to have us present to you. I don't know whether it's data that you would want us to present to you in terms of, the numbers of families that we're working with where domestic abuse is a feature. We'd need you to articulate what you're interested in for us to be able to produce that in a meaningful way.
I'd be happy to jot down a few thoughts. I'd feel much more comfortable if I could circulate them more widely, to all members of the committee. But I'd also appreciate sort of officers' views, as to what are, some of the pertinent data and so forth, that we might find informative.
I think Callum has some information that might be helpful to us.
Yeah, if I just jump in here quickly, Chairman. Community and Corporate overview and scrutiny, they're getting an update in March, 28th of March, so it's a 6-month update on the new domestic abuse contract. So what I could do is I could ask Narinder and the other officers to maybe liaise with the Children's Services team and just add in some of the specifics that you're talking about there and wrap it all up. And if members are interested, I can invite, obviously, Children's Services members along if they want to participate for that particular part. So if you wanted to jot those thoughts down and circulate them, and then once they're ready, if you send them to myself or Guy, the chairman, we can include that.
I think that's a very practical way forward. Thank you.
Right, thank you for that, Carl. Any other? Sorry, Carol, you were going to say something.
Thank you to Callum.
Yes, great. Any other questions or points relating to the forward programme? I don't see any hands, so I think we're at the end of the agenda. Just let me check. I haven't missed anything. No, so that brings me to the end. I have no other special items. So thank you all very much for your participation.
Thank you.
Oh, right, yes. Actually, it's just been pointed out to me. It's Carol's last meeting of this committee. So certainly from me, and I think the entire committee, we thank you very much for your contributions, not only to this. It's been good working with you, and we will very much miss you. All the best for your future, and thank you for everything you've been doing for us.
Thank you. That's very much appreciated. Thank you.
Good night, everyone. Thank you.
Good night.
Good night.